65-year-old Brenda Bryant has a strong family history of heart disease. Her mother died of a massive heart attack at 67.
I have to admit, I worried. Hang on.
Brenda is a longtime bus driver for special needs kids.
I've always loved my job. Doing it for 35, 36 years, I guess I should love it. I'll see you tomorrow.
The job requires a lot of lifting as well as driving. Nothing Brenda couldn't handle, but then she began noticing a change.
I would come home and I would just collapse in my chair. I was getting real tired. Let's go for walkies.
Her daily walk with the family dog suddenly became difficult.
Now you get the pain down the arm. When I first started to walk, that was a symptom.
A symptom of heart disease, the #1 killer in the U.S.
I was lucky.
For Bryant, an angiogram revealed a dangerous blockage requiring a stent.
Stents were revolutionary in their introduction in the early 90s, making the angioplasty procedure very reproducible and almost eliminating the need for emergency bypass surgery.
Traditional stents are made from a metal mesh which keeps the artery open. The next generation of technology? Stents which dissolve over time. No metal means a lower risk of re-narrowing. It reduces the need for aspirin and superaspirin, and should you get blockage elsewhere, fewer complications.
There's a lot of promise and excitement about this technology, but it requires very rigorous study.
At Dartmouth-Hitchcock, clinical trials are underway on the Abbott bioabsorbable stent. A randomized blind study is being used, which means patients won't know which type of stent they get. Enrolling in the clinical trial was an easy decision for Bryant, who found the idea of a dissolvable stent appealing.
I was thinking, that sounds pretty good, that I wouldn't have that foreign substance in my vein forever.
After being outfitted with a stent, Bryant was sent home the next day, able to resume regular activity.
What a difference. Gosh. After they put that in, it was like immediate relief. I wouldn't have been able to gone out and thrown that ball. I would have been out of breath and I couldn't have done it.
Dissolvable stents are not yet approved for sale in the U.S., but data from Europe shows them performing well.
The real challenge now is that we have such good technologies, making sure that the enthusiasm is matched by the data.
Are dissolvable stents a game changer? Maybe. While the verdict is still out, for heart patients like Brenda Bryant, it means
I got my life back. Right, Rutherford? Likes his walkies, don't ya? Were you singing, Rudy? Huh?